Today I'm going to answer the question, what are the treatment options for fibromyalgia? I'm going to do this in two ways. I'm going to give you the basic traditional medical approach, and then I'm going to share with you the functional medicine approach. And I want you to think about these two different strategies and really figure out which one might be best for you. So, as you're well aware, fibromyalgia is a chronic condition characterized by widespread musculoskeletal pain, fatigue, sleep disturbances, and cognitive difficulties. While there is no known cure for fibromyalgia, treatment focuses on managing symptoms and improving quality of life. I'm going to share with you some traditional medical approaches, and of course, number one is medication. Several medications may be prescribed to help manage fibromyalgia symptoms, including pain relievers such as over-the-counter nonsteroidal anti-inflammatory drugs, acetaminophen, and prescription medications like tramadol. Antidepressants and anticonvulsants may also be used to address pain and improve sleep. Some of the medications that you've probably been exposed to would be Cymbalta, Lyrica, and potentially gabapentin. I've talked to many fibromyalgia sufferers. Some get limited results from the medicines. Some get worse with the medicines. And for some, there's no change at all. Then number two are lifestyle changes. Making certain lifestyle modifications can help manage fibromyalgia symptoms. Regular exercise, such as low-impact aerobic activities and strength training, can improve pain and overall well-being. Sleep hygiene practices, such as maintaining a regular sleep schedule and creating a comfortable sleep environment, are also very important. Additionally, stress management techniques such as relaxation, exercise, and mindfulness may be beneficial. Now, I know there are some listening to me now that know if they were to try to exercise, they would be in bed for 2 or 3 days. I get that. So that is not for everyone. Now, then there's physical therapy, which is number three. And again, this is the medical model, and I don't disagree with all of it. So physical therapy can help improve flexibility, reduce pain, and enhance overall physical function. Therapists may use techniques like manual therapy, therapeutic exercises, hydrotherapy, which is probably the best idea. So that's in water, potentially aerobic therapy to address specific symptoms and improve mobility. And then number four is cognitive behavioral therapy. And this is a type of psychotherapy that focuses on changing negative thought patterns and behaviors. It can help individuals with fibromyalgia develop coping strategies, manage stress, and improve their overall quality of life. And I know that for some people with fibromyalgia, you've been told, or either directly or indirectly, that it's all in your head. And I know that it is not. I know that is not. But can psychotherapy help you? Possibly. And then number five would be alternative therapies. Some people find relief from fibromyalgia symptoms through alternatives like acupuncture, massage therapy, chiropractic care, and yoga. While the effectiveness of these treatments may vary from person to person, they can also be worth exploring as complementary approaches. So it's important to remember that fibromyalgia affects individuals differently, so treatment plans may vary. It's always advisable to work closely with a healthcare professional. Now, we're going to switch gears and we're going to talk about the functional medicine approach. Now, I'll tell you right up front, I'm a functional medicine practitioner. So obviously, these are techniques that I have actually used in clinical practice for 15 years. So I'm definitely on board with the functional medicine approach. So know that going in. And I tell people who come to me, if you go to a butcher, what does he sell you? Well, he sells you meat because that's what he's got. And if you go to a baker, well, he sells you bread. So there's traditional medical approach, traditional medicine, and then there's a functional medicine approach. And so now, as I get into this, just take a few minutes, you'll get a better idea of how we approach it differently. So functional medicine takes a holistic approach to treating fibromyalgia, focusing on identifying and addressing the root cause of the condition rather than just managing the symptoms. That's what traditional medicine appears to do. While the specific treatment plan, again, may vary depending on the individual, here are some common approaches used in functional medicine for treating fibromyalgia. Number one is a comprehensive assessment. That makes sense. Functional medicine practitioners conduct a thorough evaluation of the patient's medical history, lifestyle factors, genetics, environmental exposure. So we're talking about mold, maybe heavy metals or environmental toxins, and other relevant information to understand the unique factors that contribute to fibromyalgia. Number two is personalized treatment. So based on the assessment, a personalized treatment plan is developed that addresses the individual's specific needs. The plan may include a combination of lifestyle modifications, dietary changes, stress management techniques, and targeted supplementation. Then number three is nutritional support. So functional medicine recognizes the importance of a healthy diet in managing fibromyalgia. A nutrient-dense, anti-inflammatory diet is often recommended, which may involve eliminating potential food triggers. Talk about flare-ups. Many of the flare-ups can be food triggers or activity triggers, but food triggers might include gluten or dairy. Of course, functional medicine emphasizes whole foods, vegetables, fruits, healthy fats, and lean proteins. Number four is gut health. Hippocrates is known as the father of modern medicine. He said all disease begins in your gut. And I'll be honest with you, there's not a single fibromyalgia patient I've ever cared for that didn't have gut trouble, gastrointestinal distress, if you will. So functional medicine places emphasis on the health of the gut as it plays a crucial role in overall well-being. Patients with fibromyalgia may undergo an assessment for gut imbalances like dysbiosis, which is a disproportional amount of bad bacteria to good, or leaky gut syndrome. Specific interventions like probiotic supplementation or dietary modifications may be recommended to support gut health. Then number five is hormone imbalances. Hormonal imbalances can contribute to fibromyalgia symptoms in some individuals. Functional medicine practitioners may assess and optimize hormone levels such as thyroid hormones, cortisol, sex hormones, estrogen, progesterone, testosterone, and adrenal function as a part of the treatment plan. And we do that every day here. Number six is stress management. That is not unlike the medical or traditional medical approach. Since stress can worsen fibromyalgia symptoms, stress management techniques are always incorporated into a treatment plan. These may include relaxation exercises, mindful practices, meditation, prayer, breathing exercises, and counseling or therapy to address any underlying emotional or psychological factors. Number seven is exercise and movement. Physical activity tailored to the individual's capabilities, this is important, is an important component of functional medicine treatment for fibromyalgia. Not everyone can lift weights. So some people may need to start with chair exercises. Gradually and gently exercise programs can increase, but things like low impact aerobics, stretching, some strength training. You may use bands. They may be recommended to improve overall fitness, reduce pain, and enhance quality of life. Number eight is sleep optimization. Restorative sleep is crucial for managing fibromyalgia symptoms. Functional medicine practitioners may address sleep disturbances through lifestyle modification, sleep hygiene practices, and the use of supplements or medications if necessary. It is important to note that functional medicine approaches are individualized, and treatment plans may vary based on the specific needs and circumstances of each patient. Consulting with a qualified functional medicine practitioner can provide personalized guidance for fibromyalgia. Now, of course, as I mentioned, am a functional medicine practitioner. We do offer free initial telephone consultations to see if maybe we're a good fit for one another. But if the information has been helpful, if you've gotten something out of this, please like it. And please subscribe. You can click the bell. We try to put something out that's useful every week, so you'll be notified. If I can be of any help, you're welcome to call our office. I'll leave the 800 number right here. It'll also be in the description. And if you want help, I would be happy to help you. If there's anything I can do to help, please feel free to call our office. I do want to encourage you. I know there's so much frustration in the fibromyalgia community because you're not getting answers, and it is a struggle to get well. Don't give up. I know life has got something special in store for you, but please hang on. Don't stop pursuing your health. Thanks, guys. God bless you. Have a great day.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.